Hi, guys. I hope this time I've got it right. I'm really sorry for those of you that watch the Rider Clinic. You know that I am absolutely appalling with the technology. So I'm really sorry. There's some things that I'm really good at. And one of those things, just much to Fish's disgust, is not technology. So welcome. Hi, Susie. Welcome everyone to a really exciting rider clinic. I am so excited about this. Obviously, I've had rider clinics before where people have come on and we've done stuff, but you know, we've got like a bit of a treat in store for you today. So the plan is that we are going to bring Maeve on, Maeve Sheridan, who's the absolute amazing physio that I found myself online and then bought her program to start trying to improve my riding. And it's made a huge difference. And we're just going to have a chat about what Maeve does. And then we're really lucky because we've got two wonderful guests. Hopefully, we're just struggling to get Jin on. Fish is messaging you, Jin. So message Fish because I can't see it on my phone. And then we're going to bring the guests on. And one of them, absolutely gorgeous girl, but she's just had an accident. So she's very sort of in the acute phase of an injury. And then another one of our amazing friends who's had an accident a little bit of time ago, but is still recovering. So that's what we're going to kind of do. So I'm going to bring Maeve in. So I'm going to try my really bestest here, Maeve, but you know, it's a struggle for me. So if I click you now, add to stream. Yay! Have I done it?
Yes. Hello.
Oh my God. Hello. How are you?
I'm good. How are you?
Well, I must admit, my blood pressure is about 180 systolic, I feel, at the moment. And Fish's is about 220, trying to make, why didn't I do it earlier and everything else? I always think it will just work.
I know. It should just work.
I think it does. It's just that I don't know how to do it. So just for Jin, because I could now, can you see the comments, Maeve? That's just one of my questions. Can you see any comments? No. Okay, so I'm going to be comment girl. Okay. So we had a chat about doing this clinic together, didn't we? Because I met you through buying the bungee and loving the bungee, and then meeting you through the mastermind group. And then we looked at my skill set and your skill set. And then together, I think we're quite phenomenal. Got to be honest. So tell everyone, like, the people that follow me know already, but my followers don't necessarily know you. So tell us what you do and why I think you're so amazing.
Well, I am a chartered physiotherapist. So I did a human physiotherapy degree, which I qualified from about 20 years ago. And then I treated humans for quite a few years in the NHS and in various private clinics. And then I also did a master's in veterinary physio. Cool. At the Royal Veterinary College in London, with the aim of treating horses. And so probably for the last, certainly for the last 15 years, I've treated horses, but probably for the last at least 8 years, I've done just horses and riders.
Cool. Oh, that's good.
Normal people anymore. I just do horse riders. So that's my background.
Okay. I think we're the normal ones, aren't we?
Well, my husband says that she doesn't treat normal people. She only treats horse riders.
Yeah. Liking it.
So because I've done that for quite a long time now, and I always treated riders the whole way through, and then I see similar problems time and time again. And you know, there's a lot of advice and exercises available online, but whenever, you know, clients would come and tell me what they were doing and then I would go and have a look, I wasn't really terribly enamored by any of them. So I decided to create my own, and that's where Activate Your Seat came. So I started that last May.
Wow, so it's not been going that long then?
Not been going that long.
You're not doing amazingly then, aren't you?
So yeah, and it took a while to kind of start off. Obviously a lot of my clients bought the program and used the program, but then I think lockdown kind of helped me a bit because I had a bit more time to focus. So I didn't work for the first 10 weeks of lockdown. We weren't allowed to work, so I really focused on that and got a bit better at my social media game. Thanks to Ria.
Yeah.
And so it's really taken off, and it's great because I really enjoy it. And I get brilliant feedback from it. You know, people who use it do really well with it. And it's kind of getting a bit of a snowball effect. So yeah, no, it's been really good.
I think it's really difficult though, isn't it? Because obviously, as you know already, that I had a lot of surgery to the lower leg. And I think it's really, really difficult for physios that aren't riders to understand, because I feel medically that we're quite a unique group in injury set. So
yeah,
for me, like if I see somebody with a trauma, there's certain alarm bells that I would be thinking about that maybe one of my colleagues wouldn't, that isn't a rider. Is it the same with the physio, or?
Yeah, I think so. And I think a lot of physios, you know, will treat riders but don't really understand what a rider's job is involved with riding. Yeah. You know, a lot of, you know, that they think you just sit there and the horse does it all, or they don't understand the involvement of the hips and the pelvis, and really that the key of the hips and the pelvis. And so, yeah, I think, you know, when you ride, you understand it better, and therefore you can, and you know, and if people say they have one specific issue that they can't do a certain thing, then I can understand what they mean.
Yeah, because I think that's a big thing, isn't it? Because normally, if you think about it, a lot of the stuff that we do are kind of breaking stuff, isn't it? That's what we normally do. Oh, hello, City Squiddy. Yeah, we normally break things, don't we? And then you get sent off to your sort of NHS physio. I'm just watching those teeth. You get sent off to your NHS physio, and then the first thing you say is, well, what do you know, because they want to know what function you want and stuff, don't they? And you'll say, oh, well, I want to ride my horse.
Yeah.
They haven't really got a clue. And the first thing is always out of the mouth, well, you've done this like that. So why
would you get back on?
Why would you get back on? So I don't think it helps with the relationship that anyway. So I think that's amazing that you're so specialized like that. So the thing that kind of attracted me to your stuff, because obviously I sort of found you all online just using social media as a distraction from COVID, was because you'd started talking about psoas and stuff. So you were definitely talking about stuff that medically massively made sense to me.
Yeah.
That made more sense to me than things that I'd always tried before. So when I was younger, I did a lot of ballet and stuff like that. So my core is normally quite strong, even if I am podgy over the top of it. But when you started talking about things in a different way, and because I know you don't like the core, do you? That's right, isn't it?
It's not,
so tell us why you don't like the core, because everybody says if you're a horse rider, you've got a rock hard core, and they always say, I've got to work on my core. So tell us why that's the wrong
that's the
thing.
bit that frustrates me. So I hear at talks or a horse and hound or on forums, if somebody says, you know, I've got this injury, what will I do? Work on your core. And everybody's like, oh yeah, great. But, you know, we don't really understand what that means. So when I trained as a physio in the late 90s, there was no such thing as your core. That really came out probably late 90s, early thousands, when they started talking about this concept of core and core stability. And I just think it's very open to misinterpretation. So I think, you know, one physio's core is different than one personal trainer's core. And so for a lot of people, it's purely abdominal muscles. For other people, it might be this idea of the box with the diaphragm at the top and the pelvic floor underneath, transabs at the front and multifidus at the back. And
oh my God, people, I don't remember any of those names of any muscles. Can I just put that out there?
You don't need to know, but
no, I don't even need to know.
And then, so maybe somebody else's idea of the core, they'll say, oh, but it's anything between your shoulder and your knee. And so I think for the general public, that's really confusing. So when somebody says to you, go and work on your core, you think, well,
you just think,
first of all, what is it?
Sit-ups and plank. Like what else you can, and a bit of that squidgy stuff, isn't it?
Exactly.
Turny stuff, and that's that.
Exactly. So that's the one thing that really bugs me about it. And the other thing is that actually for riding,
oh,
I don't know.
Who is that?
Oh, gone.
Hopefully not coming from over the continent.
Interesting. So yeah, for riding, I think we need to think less about bracing and more about absorbing the movement of the horse. And so for me, that is the key to good riding, is to be able to absorb the movement of the horse. And if you are walking around or sitting on a horse with a very braced abdominal muscles, then you can't absorb anything. And you know, if you brace, you don't absorb, therefore you bounce, therefore the movement has to go somewhere, so it goes through you rather than be absorbed by you. And so that's not a keen on that term, and I also really dislike the term core stability, because I think it gives the impression that you're not stable and your back's not stable, but actually your back's really strong. You'll know, you've dissected them. So really strong structures. And sometimes, but as clinicians, we tell people about core stability, we give them this fear of movement, and that actually makes them worse, because they stop moving well and they brace how they move, and that actually makes them feel worse.
I think in some ways, when I'd seen your stuff, because genuinely, we don't study the muscles and the actual body in the same way that we do. It sounds awful, but you know what I mean. But it does kind of make sense sometimes when you see people that have got they're so like muscularly built up at the front, but there's nothing at the back. So surely that must kind of almost can that contribute to the backache that riders get if they've
can do. But I think a lot of the time with riders, the backache comes from the psoas. So when you see where psoas attaches to and from, so psoas attaches from this side of your lumbar spine, basically, so this front side, and then it crosses over the pelvis and attaches onto the hip. Okay. And so a lot of the time, because it's weak, and it's nearly always weak in everybody that I see, then it normally its job is to flex your hip.
Yeah.
But when you sit on the horse and your hip's already flexed, then often what it does is it pulls you forward into that anterior tilt. So it actually blocks your movement and blocks the pelvis from moving. So a lot of the time when people have this lower backache, or particularly one side and the other, or both sides right over the SIJ area, a lot of the time it's to do with psoas and how that psoas is functioning.
Okay.
And it's really difficult to strengthen, and that's why I find the bungee so helpful, because for me it's definitely the best way of strengthening it, because we're strengthening it through range. So we're strengthening it into a shortened range, but also into a lengthened range, so that eccentric strengthening work, which is really key.
Yeah. And are the problems that you find, or is it a mixture? So do you get a mixture of weakness and tightness as well? Because some people will say they're quite tight. So a lot of people, is it just a mix? Or?
Yeah, it's a mix. And so a lot of people complain that they're tight, but actually it's because they're weak. So really often the muscle is, when they complain that they've got a certain tight muscle, it's actually that the muscle is weak. And so your brain kicks in to protect the muscle and gives you that feeling of tightness, but it's actually not shortened in any, it's not contractually shortened. Does that make sense?
Yeah. And it doesn't, I think,
to protect you, so it makes it feel tight. And so people complain, oh, I've got tight hip flexor, I've got tight calves, but more often than not, they're actually weak.
Okay. And I think sometimes when you've got or had injury, you tighten up on the opposite side.
Yeah.
Because it's almost like a, thanks, Lockleven. I was just about to answer that, if that's Jane, I think. So somebody's just asked, just because I've just seen it, about where the sacroiliac joint is. So I don't know, do you want me to stand, and I might be able to actually move my horse and stop biting me? It's the kind of back of the pelvis here.
Yeah.
There's two little joints, one there, one there. Yeah, some people say it's like the dimples of Venus.
The dimple, exactly. So
not on my backside. There's no dimples. There's craters of Venus. But yeah, so it's it is. And when you think that actually, because physios, it's like somebody saying, oh, well, you're a doctor, but everybody specializes in something, don't they? Yeah. And I think we probably forget that really with physios, because obviously with physiotherapy, some people will do primary respiratory stuff, or they'll do the primary MSK stuff.
Yeah.
I know we're both the same. We're both anti-sputum, aren't we?
I would be the worst respiratory physio in the world.
I can't cope. It's the one thing I have to turn away. I can't do it. Right. So I'm just going to literally just go quick through, just check that we're not missing anybody's comments, just because we've got Gazelle. So everyone that said hi. Oh, did we disappear? I'm not sure. Oh, okay. Yeah. 2 secs. So Ginny, I'm working on it. I just don't want to cut everyone off at the same time. Everyone's very pleased about the core.
Oh, good.
And that there is no such thing. And Sue says your description of back pain is exactly what she suffers from.
It probably the most common back problem I see with riders. I mean, there are 1,000,001 things that cause back pain, and chronic low back pain is like a whole we could do 3
Well, we said
rider
we'd
clinics.
probably look at a clinic on low back pain because it's massive, isn't it?
Massive, and it's a massive topic. But for me, probably the most common thing I see with riders is that, and they'll point right onto the sacroiliac area, and that's where they get it, if they get it when they're on the horse or after they've ridden. And often once we do a bit of work on the soles and then really work on strengthening it, makes a massive difference.
And because I had SI joint pain when I spent so long on crutches and all sorts of mobility aids and whatever, but that's one thing I was left with. But I have found since I've been using the bungee, I was really, because with every exercise program, you're dead into it, aren't you? You do it all the time and then you drop off a bit. So I dropped off. It definitely loosened my seat up a bit because I was moving more with the horse naturally and much more relaxed. But then I suddenly found that I'd stopped doing it for a few weeks, and then the sacroiliac joint pain started, that I hadn't really had it that bad before.
Yeah.
But then it was like, oh, well, hold on a minute. Well, why is that come? So I started back on the bungee, slapped my own wrist, and it's gone again, you know?
Good.
So it does make, so now we've got, hold on, we do have. So Wendy says, can you recommend any exercises for me? My horse decked me just over a month ago. I spent just over 2 weeks in hospital. Wow. I didn't break anything, but seem to have lost a lot of movement in my right leg. I'm feeling a bit lost at the moment. The horse is going away soon for 6 weeks to be worked whilst I can't work him. I have another one I can ride when ready, but I need some help. I need something to focus on. It's really difficult, I think, to comment on that for you, Wendy,
specifics like that, particularly when it's acute. So I would need a lot more information as to where the movement is coming from and what checks were done in the hospital. And
I would fully agree with that. So I think maybe if Wendy messages us after the live, and then we can get a bit more info. Get a bit more info because you've been in hospital for 2 weeks, which says to me that maybe after acute injury, we need to know a bit more. So we will help you, darling, but we won't help you live because we need to know a bit more. Hannah says, this is so great. It's so hard to find someone who understands rider fitness. I think it is. And I think it is to find somebody that's actually qualified to as well. You know, because you need to have that kind of background and understanding, don't you?
Yeah, I think that definitely makes
not necessarily if you're just going to do a kind of like, oh, well, let's do a rider fitness class, and no, not necessarily, but I think if you're dealing with injury and people in the acute phases of injury or chronic injury, then you do probably need, you know, the sort of background behind. Nick says, Nick who rides Bond, you know, the beautiful thoroughbred chestnut. So Nicola's here. Hi, Nicola. She says, what about using the spiky balls of doom? I keep away from them, but Maeve, what's your opinion? The spiky ball of doom.
It depends what for, but again, it's a temporary thing. It's not gonna give you any lasting difference, Nicola. I'm afraid it all comes back to strength work. So yes, it can give you temporary relief, and that's great, but you've still got to strengthen it if you want to make a difference long term, and you want to change things. You've got to strengthen it, and eccentric strengthening into a lengthened position is the best way to change the muscle length. So if you've got tight muscles, static stretches give you maybe a little bit of temporary relief, but they're not really worth much. Same with the spiky ball, same thing. So it's nice. I mean,
I would say get the bungee or win the bungee, and you're good. But obviously on your page though, for the people that maybe, you know, can't get the bungee for whatever reason, you do put a lot of exercises on that people could do anyway, don't you? And I know you put your warm up bit on. And
I try and put a mix of stuff on, so it's not just about buying the bungee, which obviously ideally that I think that's
it works. That's the thing.
But I do put a lot of free info on there.
Yeah, you do.
There's loads of free exercises that you can follow along at home.
Yeah, and people could see how they get on with that if they need to. Vic's here, and Caitlin, hi guys. She says it's very hard to concentrate when he's being so cute. He is being cute, but he did actually have his teeth in the back of my shoulder at one point. So I was like, is he going to munch me? I don't think he would. He was very good in the photo shoot. That's all I'll say. But I will say we had to shout loose horse. And I also got covered in pear. But that's my own clues for what happened. But yeah. He is, and he's going to steal my fingers. He's a monkey. Jane loves the spiky balls for massaging her feet.
Yeah,
Good
nice
thing.
for that.
Now, what I did want to do, because I know you did it on the live you did with Vic, and people loved it, didn't they? And I think we've got like a whole new audience that maybe aren't part of that group. But when you do, on the start of when we do the level 1 and stuff, because I'm still working on level 1, you make us do something with to free our breathing up properly, because you're into the breathing, aren't you?
Well,
so tell me about that. Tell everyone what to do, because I've told them all to put joggers on.
Well, it's quite important for staying alive, as you know. But
yeah. I love a breathing one.
It's the number 1 exercise I give every rider that comes to see me gets this as an exercise, whether they are a nervous, happy hacker or they're a 5-star eventer. They all get these exercises to do, and it's to do with your diaphragm. So the diaphragm is the muscle underneath your lungs, and most of us, particularly if stress or these kind of times, lockdown, we start to kind of go into that kind of baby position, that fetal position with stress, and that blocks the diaphragm from working, and we start to use these accessory muscles up here to control our breathing, and so they're not designed to do work 24/7, and so a lot of people
it's just normally like respiratory distress, isn't it? That's when you start bringing the accessories in.
And so a lot of people will breathe as this is their prime muscle for breathing, and so they end up with really tight neck or tight shoulders, and that kind of thing. So the first thing I do with everybody is a diaphragm, what I call a diaphragm reset. And so we can do it now if you want.
Okay, yeah, I'd love to do it now.
So we'll test first. So put your thumb on your belly button and your hand underneath it. I don't know if you can see me properly. And then take a big deep breath in. So try and keep up here nice and relaxed. And what we want to do is breathe into the tummy. So as we breathe in, the tummy pushes
guys,
out.
do it. Honestly, the difference you'll feel, you'll be like, this is amazing.
So, and then blow out and your tummy should flatten. So as you breathe in, the tummy pushes out, because the air, basically the lungs fill with air, and that pushes your abdominal contents out. And then as you breathe out, your diaphragm contracts, and that flattens your tummy. And so now what we'll do is the diaphragm reset. So if you imagine an upside down Y, and so basically these corners of our ribs and then up our sternum is the shape of the Y. So if you take the pads of your fingers, I usually use middle and ring finger, and I start from the outer edges of my ribs.
Ooh, yeah.
So right on the rib edges. So you're not hooking in and under, you're right on the edge of the ribs. And I just do a bit of a rub, basically. Yeah. And so we do a rub the whole way up and keep following that line. And this is usually the nasty bit in here.
Yeah.
So get in there. So you're coming right up onto the base of the sternum.
Yeah.
And I do this every night to myself.
No way.
Yeah. Lying in bed, usually my husband's like, I'm like this. He's like, what are you doing? But particularly if I've had my horse was injured, so a very stressful week. I did it a lot last week. So then up onto your sternum. Yeah. And basically same thing. I just use the pads of my fingers, go up, right up to the top of the sternum.
Sternum is quite sensitive, because if I think about it, we're not allowed to do it anymore. But, you know, if you want to test whether somebody's really unconscious, you give them a damn good sternal rub. And I tell you what,
wakes them up. So right up to the top, and then just when you reach the edges of the collarbones, just come out to either side, just under the edge of the collarbones, both sides. And there's often, that's a bit nippy. So when I first treat somebody, I might spend 5 minutes doing this to them. It's much less pleasant when I do it to them rather than
I bet. Why you physios don't understand the concept of pain, I will say. What do they call them? Physioterrorists.
Physioterrorists.
The physioterrorists are coming round.
Right, and then same thing again. So thumb on your belly button, hand underneath, shoulders nice and relaxed, and then big deep breath into the tummy, and then blow out. And again, in and blow out. And then I would get riders to do about 15 or 20 of those big diaphragmatic breaths lying in their bed before they go to sleep. So every single night. And so if you fall asleep when you're doing it, great.
So what?
But,
yeah.
Yeah, it's totally.
But I do feel more relaxed. I've had some quite stressful meetings, and my chair at work isn't ideal, so I've kind of been a bit like this. I do feel.
Yeah.
And I also feel a bit more
drops you
relieved
down.
because Fish has worked a way out of getting Ginny Joy on, so that's brought me.
Woo.
So it's a mixture, but yeah, no, it massively works. And would you do this before you ride? Do you do that, your actual diaphragmatic reset before you ride?
I don't normally, but what I would do is if I'm going to a show and I'm a little bit nervous and I can feel myself starting to think, I'll literally do a sternal rub.
The sternal rub, yeah.
Because that, if I've done it regularly, that just reminds me.
Yeah, just to relax it off
and breathe. And I find that
it does, because you can feel your shoulders drop down again.
And so I'll get some of my riders that get really, really tense competing, then I'll just get them to literally do 5 seconds worth. And then
I love it. I love it. It's so good. So I've just seen, we've just had a load of bits and pieces through. Fish can now get Gin on, so I will give him a cue because he's doing it from the house. Nick loves your exercises. The thoracic twist ones are really good for her. Vic says don't eat the vixen. I won't let him eat my vixen. Don't you worry about that. So Nikki says, so are you saying working with the bungee to initially strengthen, but then continued use after that is advisable, or do you lose your strength and flexibility?
Do you lose it if you don't do it?
If you don't carry on with the bungee?
Well, yeah.
I mean, it would be like if you were weightlifting and stopped, surely. They're muscles, aren't they? You just can't see them.
You've got to keep doing it. So I've designed it so it's very short. I mean, it's 20 minutes.
Yeah. It's
you want to do it 3 or 4 times a week, or some of my pro riders will do 2 sets. So they'll do maybe 10 minutes every day before they go and ride 15 horses or whatever. So it's a good warm up. But I mean, like with any muscle, if you strengthen it and then stop doing it
won't work, will it?
Yeah.
Vix is doing her resets every night since you taught her.
Good.
Which is good. Right. Katie, let me just read this. Okay, so that's so Katie, we're going to actually, Lauren, who's going to come on in a sec, has actually just had a shoulder injury. So I can see the problem that you've got. So Katie's saying she's had 3 major injuries in the past, which have causing her difficulty riding. Dislocated the shoulder 3 times in 3 years and struggle with severe instability and numbness in the arm. Been checked by the surgeons and hasn't been given a solution as yet. And the other one's an old collateral ligament and anterior cruciate tear with a calcaneofibular ligament in the same injury, both misdiagnosed and causing massive problems, particularly for the cross country. So you have got some quite significant issues going on. Again, I don't think we can solve that live, but we could potentially bring you onto a clinic and we can talk about it through the clinic. Some of the things that we talked to Lauren about with an acute shoulder injury might be quite helpful.
Might be useful,
but knees will be covering on a different session. Jane Welsh wants a physio session from you now. Welch, yeah. Caitlin loves it. Amna says hi. And then Emma Johnson says she's recently got the bungee and started level 1 and can already feel the difference. I could almost immediately. It's fab. I'm hypermobile and find controlling my upper body hard, especially with keeping a steady contact. I've got winged scapulae. So is there anything she can do specifically to help with this? I think if we get the girls on and then
that might help.
Look at that, if I make a jot of that.
There's more upper body stuff in the level 2 if she has a bungee. And with winging scapula, you want kind of weight bearing arm things. So I mean, I might do a post actually about that at some point.
Yeah.
Because I'm sure there are loads of things I could show you on an exercise.
Yeah, or we could bring her on to the next clinic as well, couldn't we? So
yeah.
Okay, right. So I'm going to really try hard to get the girls in. I'm ready. Do you need to do anything for Jen? I would not be able to do this without Fish. So let me just see. Yay! I can see Lauren. So do I just press Lauren? Add to stream, but I can't see Jen. Yay! There's Lauren. Okay, so if I do that, am I back?
You're there.
I
can't hear Lauren though.
Can you hear us, Lauren?
Can't
hear you. Maybe pull there. Can you hear us? Yeah. Maybe try without. Just see. Pull them. Can we hear you? Oh, how do we get her to? I know. Let me just take you out and put you in again and just see. Remove from frame and let me bring her again. Let's just try again. Add to stream. Can we hear you this time?
No.
No. I think I know what you've done, Lauren, because I've done it myself.
Yeah,
when you log out, so leave the studio, log back in, and it'll say, will you allow it to access your mic? And you need to click allow. So leave, if you go as a leave and then try and come back in. That's it. Okay, grand. So we can go back to some of the we can go back to the comments. It's fine. So let's go back to we've done Emma. We're going to sort that wing scapulae problem out. So Carolyn Denholm, everyone should buy a bungee. It's the best thing ever.
Oh, Carolyn has a bungee. Carolyn used to have to come to me literally how often, Carolyn?
Well, she says Maeve can explain how squints. Is that a Scottish word? Squint.
She was literally like this. I use her in some of my really squint photos. But
what's a squint? What is it?
Squint is like asymmetric.
Twisted.
Like
okay, yeah.
So Carolyn, bless her, she came. I think I saw her every time I ran a clinic. I basically had to treat her, and then she got a bungee and she started using it, and I didn't see her for 6 months. I bumped into her one day because she keeps her horse at my yard, and she was like, "These bungees are bad for your physio business." Because I don't need to see you anymore. I feel great.
Oh no, that's not great. No, it is.
No, that is good. That's what I want. I thought that was brilliant. I was delighted.
Okay, so Lauren is back. So I'm going to just try and see if we can get Lauren in now. Hi, Lauren.
Can you hear me?
Yes, we can hear you. Amazing. Oh, thank the Lord, I can calm down. How are you? And nice to meet you finally.
Nice to meet you. I'm a little bit sore.
Yeah, I bet. So I've been talking to Lauren on Instagram. So she's just got the most amazing horses. She's just so super glam. She looks amazing all the time. She's got the best soch. And then we just started messaging each other. And then you messaged me the other day, didn't you? And I was like, oh my God, what have you done? So tell us, what have you done?
So I was going around the stubble fields, as you do when they're free and you're ready. And I rode Grace, who's usually the one who I'm like, I might die. Because she likes a little bit of acrobatics. She was perfect. She schooled amazing. So I got on my old boy, who's 20. I've had him since I was 15. And I don't actually remember what happened, but I think I told the lady that owns the yard, and she's like my other mother. She pretty much was like, straight afterwards, when I found you wandering through the field horseless, I said that he tripped, but I don't remember any of that now. So
bless you.
Yeah.
So how many days post injury are you now, Lauren?
It was
only
Saturday.
a few.
Saturday night, yeah. So I don't remember actually riding Figo at all, because I asked what horse was I on. So yeah, I remember bathing Grace. That's the last horsey memory I've got from Saturday, and then waking up, kind of coming to, I suppose, in the emergency in Aberdeen. So yeah.
Oh, bless you. So did you get helicoptered in, or did you drive in? Did your friend take you, or
my friend took me in? Yeah, and she the only way she can describe me is I was like Dory from Finding Nemo, because I just asked the same question over and over. So I had no memory retention or anything, so I must have bashed my head. My hat's got a little scuff on it. His saddle's muddy, his bridle's muddy, so I think he's taken a tumble and I've taken a tumble. So
shame.
Yeah.
And he's okay though, isn't he?
Yeah, he's fine. He's not really got a scratch on him. He was just, because he wears a muzzle, because he had laminitis last year, so he was away eating the grass in the corner, yes, buffet, see you later, mum. So we found him munching. He was quite happy. He didn't go far. But
what are they like?
Yeah.
What are they like?
Crazy.
So go on. So I'm cheetah skeeter, because I know what you had. So you got to hospital, and then you ended up having a CT, quite rightly.
CT scan, yeah, and then the doctor, he was getting annoyed that I couldn't remember anything, and he was like, "Do you even remember my name?" And I was like, "No, I don't know." So and then I got taken through for an X-ray to begin with, and then 4 o'clock in the morning I got taken through for another X-ray, and they got me to put my hand like above my head to see. So it was dislocated.
Yeah.
And they're saying I've got damage to the ligaments, but they can't see whether it's fractured or not because it was massive. So I'm back on Tuesday to see what the outcome of that is. So yeah.
Oh, bless you. So Lauren has basically got an ACJ joint dislocation, but she sent me her discharge letter, but for Maeve will know already, but we grade them depending on how bad they are and how much movement there is in the joint. So some people can be treated conservatively, as in have all of the normal physio, etc. And it doesn't, because you retain enough movement and it's stable, you don't need to actually have any surgery to fix it. Some people will need surgery long term to get it fixed. So I don't think you're going to know yet.
No.
The situation.
Yeah.
So the AC joint, guys, for people that don't know, is the joint between the end of the clavicle. So it's the end of the collarbone where it sort of gets joined up to the scapula, isn't it? So it comes up here and it sits there, and it's this bony bit that you can feel here. And sometimes you can see in rugby players on the beach, depending on how stacked they are, sometimes they'll look like they've got a little bat wing, you know, like when a bat's got its wings up. Sorry, because you might not know that you might end up looking like that. You might have a little bat wing, which is cool. That's cool. Yeah. Cool at Halloween.
Memory.
Yeah, sometimes you do. But then because you ride and because you'll have good muscle in your arm, you might find that actually you can't see it. Because Fish had this injury, had a grade 3, but ended up having surgery because his movement was so good. And then because he's got good muscle cover, actually you can't see it. So how have you been? Have you been coping? Have you been sleeping? You only took paracetamol in hospital. You're nails. I know.
Oh wow.
I'd have been like, pass the morphine.
I've got a really, really high pain threshold, and I think I
clearly
told them that. So they were like, I don't want to give you too much, so you do too much. So I think I kind of knew that in my head. If I get painkillers, I'm going to be lifting stuff with that arm and being like, no, I'm fine. So I kind of thought I need to let them know. But yeah, I've always been the same. I don't really feel pain much. So I'm on cocodamol now. It's just awkward, really.
She says with a little giggle. Cute.
Yeah. I've got like zero patience, so you can imagine. I went to visit the ponies yesterday just to make sure that they felt guilty. And yeah, no, I'm bored and I'm not working because I'm working from home, and they're like, you're not, because you had concussion, you're not going on your computer. So I'm pretty much just chilling with the dogs and trying not to, it's not overly sore, it's like a numbing sore. I don't know, it's a weird way of like describing it. But yeah, I'm just gonna have to be patient and see how long I'm not allowed to ride for.
And that might be a little bit. So Maeve, like, I know, what sort of thing would you say with an acute injury?
Well, it's super acute at the minute, so I mean it really is do what the doctor tells you. So yeah, rest, taking the pressure off it with your sling, trying to get as much sleep as possible to help the healing process. You could ice it no more than 15 minutes at a time. Make sure that you've got covering on the ice pack. But yeah, you're going to have to wait and see. I think once the swelling comes down, and then they can get a proper look at it and how much damage is done, basically.
I think that is important, especially with an ACJ joint dislocation, because because the ligaments have sort of unwrapped or stretched. What you don't want to do is put yourself into bad territory. So this is certainly one where I would say, do you know what? Actually, really do not do anything.
Really have to do it because it's bound down by ligaments. It's like flat bits of bone sitting on top of each other, and that's held in place by really strong ligaments. Yeah. Because they rupture, and you've some damage to them, and we don't know the extent of it yet. You've got to give that time to heal. So any movement's going to disrupt that at the minute.
Even more, isn't it?
Yeah. So further down the line, like 3-4 weeks in, they'll probably start you doing some easy movement, but at the minute you've got to do what you're told. I'm afraid.
Yeah.
So I think for our guys, what we'll do is we'll put them in a sling, and then we will say, like yours was so swollen, so they're seeing you quicker, but we would see them back in clinic about 3 weeks normally.
Yeah.
To make a decision, see where you're getting on. We'd certainly say absolutely elbow height maximum for your arm. I don't know if they've told you that. And it mustn't go any higher because you're lifting. You can feel don't try on that arm, but you can feel you're doing that. You don't need to wear this. Well, you have to wear the sling all the time. But you don't have to wear the sling at night. But some people say that actually it's more comfortable to wear the sling at night.
Well, I've been wearing it at night. I've got a spare one as well. Because when I didn't have it on when I was sleeping, like trying to get to sleep, I couldn't get comfy. I felt like if it was propped in the right position, it was a bit better. So,
bless you. Yeah, and then I guess it is just sort of I know it sounds a bit like lame, but like eat well and look after yourself, because you're actually your body's got to heal, hasn't it?
Yeah,
I think things will be very different at week 3, but we'll definitely catch up with you again. So that we can see how you're getting on. I think Gin is now there. I think this is going to go down in history if she's there. Gin, are you there?
That was so stressful.
Believe me, it was. Hello, lovely to see you. So Gin, meet Maeve, you've known already. Gin, meet Lauren.
Hi.
So I caught up with you, didn't I? So Ginny and I used to work together. Ginny Joy, she was one of our A&E sisters, but you've moved on to pastures new, haven't you? But you had a really nasty injury, didn't you? And we did a rider clinic together when you had your injury. And just remind us, Gin, what you did, because I know you've got just a bit of a residual problem, and Maeve's going to try and help you with that.
Yeah, thank you. So I managed to break 6 vertebrae and the left side of my pelvis. And my problem is around the hip.
Wow.
I know. You're a while down the way now, are you? 10 weeks, 12 weeks, are you?
5 months.
Is it?
Wow.
Is it? I know, I saw you on the pony the other day. I was like, nearly brought a tear to my eye.
I was crying.
Oh,
I know, but it was so difficult because obviously when Ginny Joy had her accident, not only did she have to come to our own department, which is just the worst, isn't it? But on top of that, it was right slap bang around the sort of start of COVID, wasn't it? And getting your physio and stuff was really difficult, wasn't it? And you were trying to do physio over the phone, which is just not ideal, is it?
No.
But yeah, so Maeve is all yours, bless you, to fix your clicky, grindy things. Hopefully.
Yeah. So the problem I have, my residual problem, is the left side, my left hip, basically. So I always feel the pain at the fracture point in the pelvis, but that just is what it is, really. Something I suppose I have to deal with until my body has fixed properly. But the reason I wanted to speak to you was because I have a grinding sensation within my left hip, and it's palpable as well. So as I'm walking, I can feel it through my fingers as well as through the joint.
and is it at the front of the hip or at the side of the hip?
It feels like it's in 2 places. So it feels like the front and the side. Nothing at the back. So.
Okay. And your x-rays were fine, weren't they?
Yeah, the scan was fine.
She had a trauma scan.
Yeah. And that was, so the hip joint itself is all good.
Yeah, I presume so. So I've not been informed otherwise, so I'd say yeah.
So you will have a lot of residual muscle tightness because of the injury. So, because and the extent of the injuries that you had, and you're not really that far down the line for the type of injuries that you had. And so I would suggest, have you had physio?
Yes, I have. Yes. It's only video calls because of COVID. They can't see
do any face.
It's a nightmare, isn't it?
I know, it's so difficult. Well, I would suggest strengthening work for around the hip, which I'm assuming that they've given you. So strengthening, you really want to strengthen psoas and glute max and glute med. So basically everything that supports around the hip, so front, back, and the side. And also I would probably direct you towards some of the videos that I have on Facebook and Instagram, where I show you how to do a bit of a release around the pelvis, because it sounds like it's soft tissue, and a lot of soft tissue tightness. It can give you that feeling of grindiness or grittiness, and I think you could probably do a bit of manual work to it yourself and then strengthen it yourself. So what I'll do is I'll get your tag thing for Instagram off, Diane, and I'll tag in some of these things, but basically they're called pelvis dissociation level 1 and level 2, and so it's really about trying to get everything to move normally and then strengthen around that area as well, and there's loads of exercises that you could do, but it does sound a bit like everything around that hip, because of the injury, has gone we're injured and then held like that, and that's quite normal because your brain wants to protect everything, and sometimes the protection that your brain offers and tells muscles to do is too much.
Right.
I think that's the same with, like, I explain with back pain to patients like that, because if I, you know, got a hammer and whack this arm, I will walk around like this for like ages, won't I? So I would naturally do that. But if you injure yourself anywhere, so Lauren, you'll probably be getting this, where all the muscles down here are tightening up. Everything around this area is going, don't move me. And it's the same in your back and within your hip, as Maeve's saying, you know, all that soft tissue. You think how much, oh, no, I wasn't giving you a treat. All of that will be there going, no, don't move, don't move, don't move, because it's anticipating pain and there's damage there. So absolutely, 100%.
And so then the problem occurs when the damage is fixed, if you like. So the injuries heal, but the brain's still telling that area to protect. And so it's trying to trick your brain almost that you're fine now and that everything can relax. And so that takes a bit of work and definitely strengthen, because you will have a lot of weakness from that injury. If you're 5 months down the line, there'll be a lot of,
it'll take a long time, won't it?
It will take time.
So Jen, do you have any advice for Lauren? Because Lauren's obviously just at the start where you were facing. She's going to go and see ortho, you know, next week and find out how long she can't ride for. Have you got? It's obviously going to be a while if it's an ACJ dislocation. Have you got? Because I know it was really difficult for you as well. What would you say to Lauren? Because you're a big rider as well, Lauren, aren't you? You've got amazing horses. And what were the things that like helped you that might help Lauren?
I'd say move to the maximum that you can. So don't cause yourself any further pain, but just keep everything moving as much as you can tolerate. And take more than paracetamol. How are you so brave?
I have no idea.
And then do myself damage because I don't feel it. So there's like
I guess. And what about mentally, Jen, with like dealing with the fact that, you know, potentially you might not be able to ride for like 8 weeks maybe? How did you? I mean, you were so sore though, weren't you, at the time?
Yeah, I mean, it's really hard actually. I think the mental side is more difficult than the physical side, because when you're I suppose when you're a rider, you're very determined that the goal is to get back riding again. So you've got a pretty clear goal. The difficulty is making your brain believe that your body will be able to do it. So I really struggled with the mental side. I wasn't used to sitting down and not seeing the horses all the time and things. But I suppose now I'm in a really good position, and 5 months later I've actually been back on, and the pain does improve, or you at least get used to a lot of things and you work out what your body wants and what hurts it.
But you guys should hook up on Instagram, because it'd be quite helpful, I think, for Lauren as well. So I'm just going to, everyone stay, I'm just going to run through. I think we've got just a couple of questions. Shall I tell people how they can win? Well, in fact, tell you what we'll do first, because you know I'm never organised enough. Maeve, tell us where we can find you on Instagram, Facebook. So Where will people find you?
It's very easy. It's Activate Your Seat. So it's Activate Your Seat on Facebook, and on Instagram it's at Activate Your Seat, and my website is www.activateyourseat.co.uk.
Perfect. Lauren, where will we find you? I found you on Instagram.
On Instagram, it's just X8LRN. It's just my registration plate. It's not very.
Nice.
But yeah, I've got my 4 horses. So if your horse,
yeah, no, you're great. I really enjoy following your account. It's awesome, and your horses are amazing. And you've just had that photo shoot, and you helped me with.
Yeah.
You know, she's got some amazing pictures on there. They're awesome. Ginny, where I know where to find you. Where will we find you?
I'm on Instagram. I use Ginny Joy Hooves and Paws more than anything else. But I have another one, but it's fine. That's the best one.
Fine. And for me, guys, you just find me as All the King's Horses, either on there or there. So what we thought about is for the bungee competition. So Maeve has very, very kindly donated a bungee and level 1 and 2 for, look, there it is. It's beautiful. That she will send to you with access to level 1 and 2 program, which is what I'm doing. You know, you're very, very lucky to get this. So what we decided we'd do is we would like you to comment below this video, or if you're watching on the IGTV or on catch up, I will put on here the instructions just so that you know what date it ends. But we just want you to put on here the biggest thing that you've learned from coming to the clinic today and why you need to win the bungee. That's it. Okay. We would obviously love you to follow us, all 4 of us, so that you can see how the girls are getting on recovering from their injury, and we will have them back on and keep an eye on them anyway. Obviously, as Maeve alluded to, there is so much information on her account. It's absolutely phenomenal. You know, I've even got fish doing the calf ones going, oh, well, I'll tell you what's wrong with your calf. You need to watch me. Yeah, so it is absolutely phenomenal. And then obviously for my account, we do the rider clinics. We have medical Mondays and stuff and bits and pieces to do. So that's grand. That is grand. I'm very happy. Is there anything anybody else wants to add? Oh, shall I look at the comments?
Yeah,
let's finish off the comments and then we're done. So, Emma Berry's got bat wings on both shoulders.
Oh,
Emma Berry, maybe you're partially bat. She's a legend. I know. Oh, Jane's just had to go. She's got an emergency in.
Oh,
yeah, that's a bit of a worry. So let me just go back here now. So we've had Emma, didn't we? And we're going to talk to her off. The squint, we've learned what that means. Okay, so Lynn. Lynn Man, I have mildly hypermobile joints and osteoarthritis, and I'm struggling with back pain. Would the bungee be of help with both these issues?
The bungee is really good for hypermobility. So the most important thing with hypermobility is strength around the joints, particularly eccentric strengthening work. So strengthening into a lengthened position so that you get so you have strength through full range of movement. So yeah, I mean, I can't answer specifics as to why. I would never claim that the bungee is going to cure anybody's pain.
No. But strengthening in any way is good for you now.
Yeah, and for hypermobility, it is really useful because it's a very controlled environment to do it within, and it will help strength work. But if you have a look on my page, there's loads of other exercises that you might find helpful as well for the hypermobility, particularly for hypermobile ankles. Some of this calf stuff that you've been making per fish do, that's really good for hypermobile ankles as well.
Okay. Grand. I've got hypermobile joints and I use it and I'm fine. So I just think it rocks. So Anna says she has EDS hypermobility. So that's Ehlers-Danlos syndrome, isn't it? Can she still use the bungee? She's had a recent fractured collarbone and ACL tear. Well, they need to heal first, don't they?
Yeah, so once you're at the stage where the consultant or your physio is allowing you to do normal exercise, then yes, you can use it. There's no reason with the hypermobility why you couldn't. In fact, I think it's quite useful for that. But you need to make sure that your clavicle is healed and that your ACL is healed.
Yeah, because otherwise it'd be a nightmare. Rosemary says she's 8 weeks post-shoulder dislocation and a fracture. And I can't see the rest of the comment. Do I need to click on it? No. I guess at the moment, Rosemary, I can't see anything else on that. So drop me a message. We can always cover shoulder dislocation. But I think essentially you just need to follow the progressive physio. Don't you?
You're still early days, really.
Very early. Yeah. It'll still be a bit unstable as well, won't it?
Yes,
if it's a dislodge.
It's all about getting enough strength around it then to cope. But yeah, you're still early days at 8 weeks.
Yeah. Don't listen to that bit, Lauren. I'll be sending you all sorts of things to keep you amused. Don't worry. Helen says check the mic's on. I think it is on. Caitlin's recently had a baby. Actually, she had a section. So she said the bungee has helped me so much getting my strength and fitness back post C-section baby. Love all the educational social media posts. So yeah, that's grand. Catherine says sometimes a simple trip can be worse. Poor you. Oh, that could, yeah. So that's Lauren. That's probably
from Lauren.
Trip. Yeah. That's Emma Berry. I hope the horse is okay. Okay. So Becca says she broke her back wedge fracture L2-3 3.5 years ago. Landed sitting down with legs outstretched. So is that a little bit like you, Jen? Did you almost end up sat on your bum and legs out? My fractures healed quickly. However, I still now get pain. Severe cramps up and down my back, and I've tried everything, regular physio, osteo, and private gym, one-to-one. I just still haven't got the same strength that I had, particularly when it comes to poo picking. Yeah. Any particular exercises that I need to be doing to help me? I don't want to go down the painkillers route. Thank you.
No,
See, I'm a bit of a painkiller fan because my argument about the painkillers is that actually, if you take the painkillers, like Lauren's fine because she's got a good pain threshold, so it wouldn't stop her doing her physio. My issue is that if you don't have the correct analgesia on board, you don't do the physio correctly, so you don't get the strength. So sometimes I think you need to, and for me, that with an old injury, I would say get your pain under control so that you get your physio done properly.
Yeah.
And that you get your strength properly, because at 3.5 years she should be able to be pushing herself and build the strength that way based on the info. But
yeah, I agree. I wouldn't go down the painkillers route without doing the strength work. So if you have painkillers so that you can tolerate doing more strengthening work, then that's great. I would also look at your psoas and try the pelvis dissociation video that I have online. You'll find it on my Instagram page, but I would definitely look at strengthening your psoas because of where it attaches. And so a lot of the time with poo picking and bent over tasks, a lot of the time it's to do with psoas weakness, and then people get pain when they come back up again.
Okay, so next one is for Jackie, Pixie and Ponies.
Oh yes,
sent us a question. So she's had a laparotomy. So for everybody, she's had a cut all the way down here. And she just said that she's really struggling with getting, I know you hate the core, but getting core strength back. And even if she kind of like kneels down to get something, she's really struggling to get back up. But she just can't get that pull where she has. Lovely to see she was back on a horse for the first time last week, I think, was it, that she got back on? So that's amazing. And she's obviously had a real sort of journey with her health. But is there anything, so to me, the answer is just bungee every time. But is there anything specifically that you'd say about
try and win the bungee? But definitely, I wouldn't overly focus on pure abdominal strength. I would just do general strength. So you've been through a huge health scare and you know, huge major abdominal surgery, but don't just focus on getting the abdominal muscles kicking in. Try and do general exercises. So even if you were, you know, when we do things like press ups, you still work your abdominals. Squats, you're still going to work your abdominals. So I would go for big general exercise things, so like squats and lunges and general strength around the pelvis, because that will really help get you up when you're struggling to get up off the floor. And I wouldn't overly focus on just working the abdominals. I would just go for general whole body strengthening work.
Yeah, I would say that as well. And the other thing I would say from a sort of surgical perspective is that, yes, like when we go through the midline, you know, we're not actually cutting muscle. You're a bit off course if you're cutting muscle, because the rectus and everything comes together. You know, the six pack, it kind of sits like this, and it's like a fascial sheet that actually you're going through. So if you can, and obviously the abdominal muscles come all the way around, and again, as you've said, you know, it's strengthened by so many other things. And it I think with that sort of surgery, knowing the extent of surgery that she has, I think I think she will get even better than she is yet.
Yeah.
You know, I think she's,
Definitely.
you know, she's had such a massive sort of insult to her body. It's just going to really take a bit of time, because it's all soft tissue as well, isn't it? Which I think sometimes people underestimate soft tissue injury.
Yeah.
You know, because like Lauren, yours is classed as a soft tissue injury, but it is a dislocation, and it's a you know, in theory, it's a fracture dislocation.
Yeah.
But people always think, oh well, it's not broken. And sometimes if you do break something, it's easier, because we say, well,
And
you
it heals
can't do
quicker.
that, and we'll make it still.
Yeah.
But if it's like Gin's was and like yours is, you know, you can't keep your pelvis still, you can't keep your back still. So actually, it's like crack on, and it is painful. Like it's really, really painful, and you know, pain gets you down. You know, so so last question is from Jane, and she says, a question for both of us. She often gets clients coming for help with confidence after injuries. Okay, so Jane's it's Jane Brindley, so she's a confidence coach. It's confidence horse riding confidence Scotland, is it? Yeah. So she's great. Sometimes they come before they've properly healed and wanting to get back to riding ASAP. I think that's all of the goal, isn't it? First thing I said, you know, before going under the anaesthetic was, when can I ride? Like, I just need to know when I can get on the horse. I tend to say that they must follow the doctor's advice to cover myself and for their own recovery. So what do you think about riders riding before they're fully healed?
You can't stop them. It's very difficult to stop them. And so I think it depends on your injury. Lauren, don't get on a horse.
No. Yours is a definite no. Yours is a defo no. Defo no.
I think it depends on the injury. It's very independent, and on the person, on what type of horse they have, how the horse is going to react. But you know, at the end of the day, you can't stop them. People have to make their own decision and be responsible for their own health. So most riders will want to get on before they are told to. And it also depends on the consultants, because obviously Diane rides, so she understands, but a lot of consultants were like, oh, you're never to get on a horse again. Yeah. And so that doesn't help either. And so I think they have to follow the medical advice.
I would agree with that. And I think if they're seeking kind of approval from her when she goes, oh well, you agree with me, I should be able to ride, then I don't think I would give that. I would just say, you know, it's your choice. You know what the medical advice is. You know, if you choose to go against that, you go against it. You know, you can't. I understand the frustration of it and wanting to, but again, you can, when you do get back on, you can take steps to minimize it. So Ginny, you did that, didn't you? Because you rode Polly rather than getting straight back onto Bailey. So you can, you know, you choose the horse very carefully that you get back on. You make sure there's someone there. You maybe get somebody to ride the horse first. If you're in a school, you might lunge it first. But you just get all those bits that could go wrong to make everything as smooth and as easy as possible, because it's not easy, is it? So that was great, guys. Thank you so much. I've really enjoyed it, but there is a gazillion comments that you will be able to see once we log off. But thank you so much. So for the bungee guys, you can follow all of us on Instagram. We would love to have you. If you want to win the bungee, then you need to comment on the biggest thing that you learned today and why you need the bungee, and then we will get together and we will have a think about who's going to win that. And then the next clinic date will be Wednesday the 21st of October, and I personally think this has gone really well and really enjoyed it, and I think we've talked about doing this again. We will keep up with your progress, Lauren, if that's okay, and we will keep up with yours, Ginny, as well, if that's okay, and we will see you all very soon.
Thanks for having us.
Thanks, guys. Take care. Thanks a million.